Hey guys, welcome back. It's Karen Srezzo, and I am here with a very special guest. Monica from Impact Wellness is joining me today. So thank you for being here.
Absolutely. Thank you for having me.
Definitely. And we've had some great conversations, just you and I just sitting, chatting, having coffee, that I thought would be, important for others to hear. So before we dive deep into those, tell us a little bit about who you are, what you do, how you got started, all that good stuff.
Yeah, so I'm a regular everyday person like everyone else. I'm a mom, I'm a wife. Like to take a walk. I like to travel, do all those things. But during the day, I am a family nurse practitioner and the CEO of Impact Family Wellness. And we are a direct primary care office, which is like a gym membership for your doctor. So we basically take all the struggles out of healthcare and make them easy. So we make it affordable, personalized, and somebody who actually knows your name and gives a crap. Kind of like the old Cheers place where everybody knows your name. Like that's what we do. So uh yeah, I'm just a regular old person who wants to do what I love, and that's take care of people. And so that's what I do now instead of insurance companies. But I could talk crap about insurance companies for days, so let's not get on that topic.
I could too. And I'm
Hmm.
not even in that part of the industry. Just being an average Joe, I definitely have my 2 cents. So first off, you are in the kind of the Austin area. So tell us a little bit if you're in the Austin area and you're listening, where your office is located.
Sure. So we have three office locations currently. One is in Cedar Park, which is North Austin. One is Liberty Hill, Georgetown, which is a little further north, about 15 miles north of Cedar Park. And then we have an office out in Thorndale, Texas, which is to the east of Austin, just past Taylor, Texas.
Okay.
So we're really in that northeast Austin area. Mainly that's the area we service. But we do a lot of what we do virtually. So we can service anybody who actually has a state of Texas address. As long as you have an address or residence in the state of Texas, then we can treat you as a patient in my office. If you're outside of the state of Texas, I'm not your girl, but I
Right.
can find
That's
somebody
okay.
who is.
I was going to say, but you can always share some information so that people can figure out who their girl is. And that's
Absolutely.
important to have somebody in your corner. And is that basically why you kind of broke off and launched your own business?
Absolutely. So I have been a nurse practitioner for 16 years, and for the first 10 years, I worked in the insurance-based world. I did primary care, I did orthopedics and vein work, urgent care, all sorts of different things. But the commonality between it all is I spent 70% of my day doing paperwork. And that's not what I went to school for 9 years to do. I went to talk to people and create relationships and take care of them. And instead, I was incentivized to write prescriptions and spent my day writing charts so that an insurance company would pay the claim on the visit I just had with my patients. And I was basically treating them like cattle. I had to see 30 patients a day in order to keep the CEO of the business happy because of billing reasons. But there's so many rules and regulations put on healthcare providers by insurance companies that I couldn't actually do what was best for the patient in majority of situations. And that's everything from like you're here for your annual physical, but I can't do your pap smear at the same time because the reimbursement isn't the same if I do them on two separate days. So now you're going to have to take off work twice to come see me. And guess who doesn't come back to get their pap smear done? Because
Right.
guess what? It's not fun. All right. So you already
Right.
took off work. You already are in my office. You already waited for 10 minutes to see me. Yeah, you're not going to come back for that. And that's
No.
not great care. And then I would also see patients and, come up with a treatment plan and tell them, hey, call me if things aren't going well. And they would call me. But I was like the Wizard of Oz in the back, right? Like you can't get to me unless you get through three gatekeepers when I'm really the one that needs to know what's going on. And so I would have patients show up weeks after and they'd be miserable. I'm like, why didn't you call me? And they're like, I did, but I got the receptionist and then the medical
Mhm.
assistant and then the nurse, and I never actually got to you. Their answer was schedule an appointment because that's how we get paid, right? If I talk to you over the phone, I don't get paid for that. I don't get paid for that time, right? I'm not like a lawyer who can bill for my time. I only bill in the insurance based world if you actually come see me.
Right.
And so it was just this really broken system. So I was looking for a better way. And, a Facebook ad told me about direct primary care, which is basically a gym membership. It takes it back to healthcare of the 40s when you had a real relationship with your provider. And so, I saw that and went to my husband who has an MBA. And I said, I'm going to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. And he laughed in my face. But here we are, you know, 6.5 years later, and we have a really successful practice that does exactly that. We just take care of people. We're here to be advocates for our patients. Just like a plumber doesn't expect me to know how to clean a toilet or fix a toilet, I shouldn't expect my patients to know how to navigate this system that we call healthcare in this world. It's difficult, but especially when it comes to your health, it's the most valuable thing you have. I don't care how much money you have. If you don't have your health, it doesn't matter. And so allowing people to take control of their health and letting them be in the driver's seat as opposed to their insurance company is huge. And so it allows us as providers to have a significantly better relationship with the patient because you are now the customer, not your insurance company. And so it's really revolutionized not only my life, but the providers that work for me. I have 7 nurse practitioners that work for me, and our patients love it, and they never leave because they can't go back to the old system. So
Yeah.
yeah, it's all about taking care of patients and doing what we love. So
Well, and it's so eye-opening, because I listen to, other podcasts that talk about, what kind of goes on behind the scenes, because we have no idea, really. When we go into the office, we think your goal is to set me up for success. And sometimes that's not going to happen because of what's going on in the back end. A lot of us don't understand that. And the more I work with women clients who come to me and they're like, well, my doctor said this, or they can't do this, or their hands are tied about this, I have to go back for this. It really is just jumping through a lot of hoops. And like you said, at some point you just kind of were like, I'm not going to do it. I don't want to do it. I don't want to do the time. I don't want to take the energy, as
mhm.
as the person that, needs the healthcare. And then you on the other end, you just feel like you're constantly battling to get small results for people. Um,
Yeah.
so I love what you do, and I want more people to know about it because it is so important. And we are noticing, I think, through what's going on in our current climate, we are noticing that the healthcare system maybe is not necessarily working to our advantage right now. And I think we're starting to open our eyes to some of that, which has been really interesting. So I want more people to know that you exist and that there's other options out there besides what we've always been told. We've always been told you
Mhm.
just get health insurance and you follow this road and that's it and that's your only option. And that's not true. So
Absolutely not. Yeah.
so I'm glad you're here. I'm glad you're sharing that. I'm glad to know that you do virtual for those that are in Texas. And like you said, we can always figure out, how can you find this if you're outside of the state of Texas, something similar to this, so that you are getting the relief. But one of the things you and I talked about, so you're significantly younger than me, by the way. But we're both going through kind of that midlife transition. Yours is a little bit more at the beginning stages. I am fingers crossed, hoping I'm close to the ending stages. But both of us have been trained to have a level of expertise in our respective fields. And I know when I started going through perimenopause, I was struggling. And we've had conversations where you've kind of felt the same way, and you're going in with an abundant amount of knowledge that the average woman would not have about
Mhm.
health and how to stay healthy and your hormones and all of that. So I kind of, when I first started going through this, I'm like, wait a minute, I know a lot of great things to do for my health as a health coach and as a trainer, as a nutritionist, and I'm struggling. So how has your own journey through the beginning stages of midlife and perimenopause, how has that shaped your approach to wellness now that you have a little bit more control?
Yeah. It's changed a lot. It's funny. So I became a nurse practitioner when I was 25. And so I was really young and just kind of did it. And I always had these patients and they're like 40s and 50s and would complain about, these menopausal symptoms. And I was like, yeah, whatever. Everybody says getting old sucks. And I was like, can't be that bad.
Right.
And now I'm in the thick of it and I'm like, dear God, this is awful. Right. What women don't realize is menopause is the end of the world, right? So you get the diagnosis of being postmenopausal when you haven't had any form of vaginal bleeding for 12 months. Like
Mhm.
that is the only way to get that diagnosis. The perimenopause and menopause, right? That realm is 15 years, right? Like it's not just this little time where all of a sudden you have hot flashes for 2 months and then you stop bleeding and it's over. It's a thing. And we're learning more and more about this in the healthcare world. I'll tell you, when I graduated from NP school 16 years ago, the talk of hormones and menopause was approximately 12 minutes long. And it was like, this is how you diagnose it, and you don't do anything about it unless they're literally dying. And it was because the only option at that time was oral estrogen, which is a very high risk for increasing your risk of cancer. And so we just didn't ever prescribe it. And so it's really only been in probably the last 5 to 10 years where hormones have even like come out to play because they're much safer now, right?
Yeah.
So we have creams and pellets and pills and all sorts of different forms. Um, and it also used to be that only estrogen was ever talked about. But now we're talking more about things like testosterone, progesterone, estrogen, that sort of thing, which I think is really great. But also, I will tell you that our lifestyle, especially here in the United States, is not helping any of us
Mhm.
because approximately 80% of the healthcare complaints that are brought to healthcare professionals at this point are directly tied to chronic stress.
Yeah.
And that is like mind blowing to me, but it makes sense. High blood pressure, diabetes, anxiety, depression, hormones, right? So my hormones suck right now, but I don't think it's necessarily because of my age. Like I'll be 42 next month. So I'm getting into that world, but I literally have zero testosterone. Like it doesn't exist. And I've tested it for over a year, like just waiting for it and trying to do supplements and do these things. Um, and I don't think it's necessarily because my ovaries have pooped out. It's because my adrenals have pooped out. And that is
Yeah.
because I've been chronically stressed since I was 9 years old, right? I was a third grader and they gave me this stamp of being a gifted kid, right? I got put in that gifted class. And since that day, it has been like balls to the wall. I'm never enough. I have to get perfect grades. I have to do all of these things, which has been my entire life since I was 9, right? So for 30 years, I've been stressing myself out about being the best in the class and getting the best grades and doing the best things and being the most successful. And it's literally been in like the last year that I'm like, you know what? I am enough. I'm enough just how I am. And that's hard on some days. It's really
Yeah.
hard, especially as a business owner, right? And so I think not only is it a combination of now we know more about perimenopause, but also the food we eat in this country is horrific. It's so ultra processed that it's killing us all, and we don't even realize it. But also the chronic stress that we deal with in this country. It's killing us all. My husband and I were talking the other day about like socialized healthcare and how like that's the system in Europe. I was like, it can't work here. It will not work in this country because we are too sick. Our
Yeah.
population is so chronically ill, and it's because of the lifestyle we live over here. Not that Europe doesn't have its problems, right? Every country has its issues. But I'm going to tell you that the stress that we put on people here, our terrible lifestyles, it is what's killing us,
Yeah.
right? Like we see more cancer and all of these things. Yeah, it's because of the crap that we put in our bodies because it's convenient, right? Like
Right.
it's much easier to drive through the McDonald's drive-through than go to the store and get something that also is not covered in pesticides and has, real value to it. And so, the struggle is real for sure. Uh, and we just have to be our own advocates, and we need to realize like you have to manage your stress. You
Yeah.
100% have to. And whether that's meditation, yoga, reading a book, taking a walk, doing these things, like I would tell you the four most important things to health are: what do you put in your body? Are you moving your body? And I'm not saying
Mhm.
exercise, I'm saying move your body. You
Move.
don't have to sweat.
Yeah.
Just, touch your toes a couple times a day. How are you managing your stress? And are you sleeping? And if those four things are not your top priority, your health is going to suffer.
Well, and there's so many things that you said that I want to get into. Number one, chronic stress. I think a lot of people think I haven't been stressed out for X number of weeks. but it's not weeks, it's years and years. And like you said, we might not even have noticed in our childhood, whether it's, being a high performer, or we went through a parent's divorce, or just these things that we didn't realize were affecting us that have just built and built and built. And so as our hormones decline and our adrenals are like, okay, it's my time to shine, but they're so tapped that there's no light there for it to shine. We've set ourselves up for failure, and we didn't
Mm.
even know because it's been going on for so long. So I think
Yeah.
that's an important one. And number two, those four things that you mentioned, these are the four things that I talk about all the time. Those four pillars of, how can you reduce stress? How can you sleep? How can you, what are you eating? How are you moving? I will tell you, those are very rarely mentioned when you meet with your doctor and you're discussing,
Mm.
I think I might be in perimenopause. Those questions aren't even asked, because I ask my clients all the time, did they ask you about this? Did they ask you? No, no. Either they brushed them off, or they just gave them like a prescription for an antidepressant or whatever, something else. And none of these things are addressed. And I love
Mhm.
that you say that, because that is some of the things that we need to be talking about when
Uh-huh.
we are seeing these professionals.
Yeah. I I did it for 10 years, to be honest. That was never a question. Like, especially your annual physical. Those should be what we're talking about at your annual
Yes.
physical. But instead, I'm like, so you feeling okay? Cool, awesome. But don't tell me you're not feeling okay, because then it's not no longer an annual physical, it's no longer preventative. It's like, oh, did you do your mammogram? Did you do your lab work? Okay, here's what your lab work says. Like, that's all that we ever talk about. And that's because talking about sleep, stress, body movement, and nutrition doesn't pay the bills. What pays the
No.
bills, unfortunately, is writing prescriptions.
Yeah.
We also don't have the time, right? Your average time with a healthcare provider is 7 minutes. We can't talk about those four things in that amount
Yeah.
of time. It's not physically possible. And
Right.
so those things get pushed to the back burner. Instead, it's like, oh, how are you tolerating your medicine? Or, oh, your blood pressure's high. Let's put you on the pill, instead of, why is your blood pressure so high? Like, what are you doing about it? Don't get me wrong. There's a time and a place for a pill. There's a reason we have real medications, right? Like,
Right.
they have their place, but we completely overuse them because it's much easier to put that band-aid on top of
Right.
it, as opposed to talking about the things that actually are contributing to it. Also, people have to be willing to change,
Yeah.
right? There are patients that just want a magic pill. They want to come in, they feel terrible. Okay, take this pill, everything will get better. It's not real life, right? As much as I would love to say, yeah, just put me on a testosterone replacement, that's cool. That might help some of my symptoms a bit, but that's not ultimately going to fix my problem.
Right.
Changing my stress level, making sure I'm sleeping. All those four things are what's
Yeah.
going to continue it in the long run, right? And so, yes, thankfully we have these great things like testosterone replacement, estrogen replacement, and progesterone. I've made more friends with women by putting them on oral progesterone than anything else. If you are in perimenopause and you wake up between 2 and 4 a.m., I'm going to tell you have a progesterone problem.
Yes.
It will fix it. It's a miracle, right? Like, it is an amazing thing. Yes, that is where a prescription for progesterone absolutely necessary, because if you don't sleep, life is getting real ugly.
Right.
But at the same time, you also have to make sure that you're putting your phone down and you're going to bed at a decent hour, like that you're giving yourself the chance to sleep,
Yeah.
because so many of us work from 7 a.m. till 9 p.m. We're constantly on our phones and doing all the things and not connecting with people, and just like in this world of social media. And we have to stop. I will tell you, doom
Yeah.
scrolling is one of the worst things you can do. Turn off your damn phone.
Yes.
Turn it off.
Yes. Yes.
Turn it off.
It's there's so much to all of that, and you are correct about the Band-Aid solution. Instead of addressing, okay, we can put you on this medication, but let's figure out why we got to this point to begin with. What are you doing that's
Mhm.
leading up to this? And we don't ever address that. And the other thing I
Yeah.
think, what I notice with some of the women that I talk to, I think some people aren't informed as we're evolving in this new season, of midlife and perimenopause, and more information is coming out and research is done. And not necessarily are the doctors informed, or do they feel equipped to actually address some of this stuff. I had a
Hmm.
client recently tell me that she told her doctor, I'm having X, Y, and Z. One of the things she mentioned was, I have a low libido. I love to be intimate with my husband. I want to be intimate with my husband, but I don't know what to do. And the doctor said, I'm not your sex therapist. And I said, you need a new doctor.
Yeah.
And whether it was she didn't feel comfortable talking about sex, which seems weird, or she just didn't know what answers to give. I wish more people in these elevated positions had the balls to say, you know what, this is not my expertise, this is not my wheelhouse, but let me refer you to somebody that is, instead of just saying, well, either we're going to dismiss it or let me give you this prescription and send you on your way. Um,
Yeah. It's 100% true. And like I said, when I went through school, we didn't even talk about these things. And
yeah,
so it has been me going to conferences and me learning and me researching and doing these things to educate myself on what it is. Let's be honest, there's a lot of hormone treatments that are still not FDA approved because that process takes forever. It doesn't mean they aren't great and that they aren't safe. It's just they haven't gone through the right process. And so a lot of healthcare providers refuse to do anything that is not 100% FDA approved, which is fine. They can do that. But if that's your healthcare provider and you're looking for a fix for hormones, then you're in the wrong place, right? And so much of how that treatment is done is based off of numbers. We You shouldn't be treated as a number. We should be
right.
treating symptoms,
Yeah,
right? I don't care if your testosterone level is in the crapper. If the symptoms you're having are not related to testosterone, we're not going to treat your testosterone, right? Like we shouldn't be treating a number. We should be treating numbers along with symptoms. And
yeah,
so there's a lot of providers that don't even understand the female cycle, right? So if you're like me, I still cycle, right? I still have a
yeah,
monthly cycle. And the hormones go like this in those 28 days. And so if you don't get your hormones tested on the right day of your cycle, if someone orders your hormones and says, okay, go get them done, and does not tell you what day of your cycle to get them done, they have no idea what they're doing. And you need to find a new provider because those levels can be all over the place. Your estrogen can
yeah,
be 5 or 250 depending on what day you're on. And so if we don't know what day you're on when we do those labs are null and void. It does us no good because
yeah,
if you're on day 19 and your estrogen level is 5, there's a real problem. But if you're on day 4 and your estrogen level is 5, then that's fine, right? Like you have to know these things. And so you have to advocate for yourself and find a provider who actually has a clue what they're talking about. If you say the word hormones and they say, we don't need to check those, or you're too young, find someone
yeah,
else
yeah,
because you are never too young. And
right.
unfortunately, a lot of insurance companies will not cover the cost of checking your hormones. So I need a direct primary care office, right? It's $27 at my office to check all of your sex hormones. And we can do it because we don't have to deal with your insurance bullshit, right? Sorry, I don't know if I was allowed
So
to say
you're
that
fine.
word on this
Yes,
podcast.
you can.
Um, so you have to find the right provider. And I will tell you, a lot of them that are in those big box store like facilities, right? Your big Baylor Scott and Whites or your Kaiser Permanente, they may not be up to date. I'm not saying that
Right.
none of them are, but you have to find the person that was willing to go above and beyond to figure that out. Do they
Yeah,
have to be a functional medicine provider? No, right? You need somebody who's more, let's call it holistic, right? And all holistic means is mind, body, spirit, right?
yeah,
It doesn't mean that you only do quack things that are
right.
considered
People think
quacky,
it's so
right?
foo-foo. I'm like, it's not. It's not.
No, like holistic means, at least in my world, is talking about all of the things about
Yes,
you as a person and incorporates Eastern and Western
yeah.
medication when it's necessary,
I would
right?
say the same
And that's,
definition. I would say, yeah,
yeah, and that's really what we do at my office. Now, functional is more like a peptide world. That's a whole nother level. It's not what we do at my office. Those people are great if that's your jam. But there's a time and a place for a supplement, and then there's a time and a place to just get really expensive urine.
yeah,
So I hesitate with providers who make a lot of money off their supplements, right? I have a conflict of interest there. Like if I, as a healthcare provider, I'm your trusted person and I'm going to make extra money off of the supplements you're about to buy, maybe not, right?
yeah. I'm
Um,
always leery about that.
you know, and some of them are great. And if you've found the provider that does that for you, awesome, do it. It's fabulous. I know a lot of really great functional medicine providers, and they are phenomenal humans. But you have to find what works for you.
Yeah,
And if the person sitting in front of you is not working for you, then go find someone who is. And that might be hard, but ask your friends because there is someone in your neighborhood, right, that has a clue what they're doing and will actually deal with your complaints and not just brush you off because I don't have time to deal with your hormones.
Well, and I think that's where a lot of this comes in. I'm so glad that people are having the conversation now because I do feel that it empowers women with information, but it also empowers them to be like, I'm going to get care for myself. I'm going to advocate for myself. And if this isn't working for me, then I have the strength to move on to somebody else. So many times, I hear, oh, but this person delivered my babies and that's great. And they were probably perfect for that time in your life, but you're not there
Mhm.
anymore. And just like everything else is evolving, your medical care has to evolve with you. So I
Absolutely.
get a lot of, oh, go ahead.
Oh, I was just agreeing with you.
Oh, okay. Well, of course. Yeah. I get a lot of people that say, my doctor either one won't do a test because there's no test to tell me I'm in menopause, which is accurate, or they
Mhm.
do run, they run the standard test and they come back and they're like, you're normal. And I always tell people, listen, normal's great, but that doesn't mean it's not treatable. And who's normal, right? Who's normal are we comparing this to? So
Uh-huh.
in your office, like what kind of tests or screenings do you think women should be asking for?
Yeah. So in the hormone world, we all think thyroid, right? So thyroid is a
Mm-hmm.
hormone, but if they're just checking your TSH, then you're missing the whole picture,
Mm-hmm.
right? So
I learned
thyroid
that.
stimulating hormone is actually the last one of your thyroid hormones that will change. It's really cheap to check. That's why your insurance will approve it.
Mm.
But you should really be getting a T3 and T4.
Mm-hmm.
And if those are even remotely off, getting a anti-TPO or reverse T3 is a really good idea. Cortisol can be checked. It's one of those like, well, what do we do? Right? So if your cortisol is too high, then you're stressed out. If your cortisol is too low, then it's likely because you've been chronically stressed and your adrenals suck,
Have
right?
failed.
They're
Yeah,
already out.
yeah.
So cortisol, I think, is a good idea just to get a general number for, but the ultimate answer to any cortisol issue is reducing stress. So,
Mhm.
do you check it or not? Because the outcome's going to be the same. That's really your choice.
Yeah.
I think insulin is really important. People don't realize that
Yes.
insulin is a hormone, and it is the first hormone that will change if your blood sugars are off, which we oftentimes see in perimenopause. People become insulin resistant. And
That's what
so
yeah.
your right, your hemoglobin A1C might be perfectly fine. Your blood glucose level is great, but your insulin level is 25. That's a problem, right? And so getting an insulin level checked, which no insurance company is going to cover. So caution, if you find a DPC company, it'll be $5, right? Ish, depending on your office. And then sex hormones, right? So there's testosterone, both free and total for women is very important. Estrogen, progesterone. DHEA is a precursor to testosterone. Sex hormone binding globulin is also very important, as long as your provider knows what to do with it.
Right, right.
But once again, that's a thing, right? Like I just shut down my office for 2 days and sent my entire staff to hormone training because it's that important to us.
I
And so,
I
yeah,
cannot
it was
wait
like,
until we can chat about what you learned because I'm so
well,
excited.
I didn't actually go. It was not me.
Oh, they're going to give
I
you the
sent my
rundown. Okay.
Yeah, I mean, I sent my whole staff. So if you need a provider who knows what they're talking about, just call one of my nurse practitioners. Um,
Yeah.
but yeah, so those are, and also vitamin D is a hormone. We don't
Yes.
realize
Yes.
that that is a hormone, and most people are deficient. If
Yes.
you are not on a vitamin D supplement, you are likely deficient. We just don't have enough of it in our soil anymore
Yeah.
to actually give us what you want. Now, if you eat 100% organic and you eat a lot of whole foods, then maybe you're okay. But I'm gonna tell you, you should have your vitamin D level checked, and you probably need a supplement. So, yeah, insulin, thyroid levels, cortisol, sex hormones, and vitamin D, I think, are all incredibly important to this world that we call life.
Yes. Now, somebody like me, like your cycle is still consistent, so hey, this
Mhm.
is when I need to go check it on whatever day that your
Yep.
level of expertise says, because I could not tell you what day it is. But
19
something
to
like,
21. That's the
what is
answer.
it? I got to
Day
write this down.
19 to 21. So day
Okay.
one is the first day of bleeding.
Okay.
19 to 21 days later is when you should get those checked. And that's because your estrogen and progesterone are the highest at that
I
point. And so
love
if
that.
they're
Okay.
low, then I'm going to know. So 19 to 21 is what I do. There are some providers who check it day 3 to 5. That's just not how I was trained. It's not the education I have. So
Okay.
Not that they're wrong. If your provider at least gives you a date range, they're probably somewhat on the
Well,
right path.
I was getting ready to say, you're the first person that has ever said that to me. And I had no idea. And like I said, I have done a ton of research on menopause and gone to workshops and read a ton of books, and nobody has ever mentioned that. So a situation like mine, where I am having my period every 4 months right now, and hopefully
Yep.
every, hopefully we're getting close to the end. Like I said, in a
Uh-huh.
situation like that, how do I know when is the best time to take a test? Is mine kind of, you can take it anytime because you're already skipping cycles, or
Yeah. So at that point, the actual lab work becomes less important, to
okay,
be
that's good
honest,
to know.
right? Like
Okay.
we know because you don't have a regular cycle that your hormones are off, right? So at that point, yes, we can check them. I would when to get them checked, that's kind of a crapshoot, to be honest,
Yeah. Okay.
right? I could tell you, well, let's wait till your next period and then do it 19 to 21 days later, but your cycle is so long at that point that it doesn't actually matter. So when I would get those labs back, I would have to take them with a grain of salt. At
Yeah.
that point, we're talking more about symptoms, right?
Okay.
So top
Okay.
5 signs of low estrogen are hot flashes, abdominal weight gain, irritability, brain fog, and vaginal dryness. If you have those things, your estrogen is low. I'm going to tell you based off of your age and the fact that you only have cycled every 4 months, your estrogen is low. I don't need a lab test to tell me that.
Right.
Now, if you're 42 and still having a cycle, I do need to know your estrogen level because it might actually still be high. And then treating you with estrogen is the last thing I want to do,
Yeah.
right?
Yeah.
Um, if you're not sleeping, your progesterone is low, right? Like that's just a no brainer. And so putting you on a progesterone supplement is something that we can do regardless of what your labs look like. Now, if I get your progesterone back and it's sky high, then maybe we need to look into something else. Um, and testosterone is one of those that really can be tested at any time during that. But because of your age and your cycles, at this point, we're going to base your treatment off of what your symptoms are.
Okay.
Right. So if you have
Love
none
that.
of those
Yeah.
5 symptoms associated with estrogen, then why the heck would we put you on estrogen?
Right.
Unless you have a very strong family history of heart disease. Heart disease is worsened by a lack of estrogen. And so if you have a very strong history of heart disease in your family, you may want to consider estrogen supplementation just for preventative reasons for that. Same with osteoporosis. But if you don't have any of those symptoms, then we're not going to treat you with estrogen anyway.
Yeah.
So honestly, at that point, the lab doesn't matter as much. I will tell you the
Okay.
labs matter more if you're younger and still cycling because it tells us which of your hormones is really suffering and where we need to focus on that. Um, like low testosterone is low libido, but that can also be by a lot of other things, right?
Yeah.
Kids, sleep, life. Your husband didn't do the damn dishes, right? I'm gonna tell you, my husband wants to get some, just go do the dishes. That is your best chance,
What?
hands down, right? So low libido is definitely a sign of a testosterone. But weight gain and muscle wasting are also from that. But if you get too much testosterone, then you also gain weight and you get like acne and hair. So you have to be really careful about like
Right. Right.
what we're doing here. But ultimately, anytime you're doing hormone treatment, it should not be to make your labs look good. That should never be the focus. It should be to make you feel good. And if that's not happening, then it's not worth it. Now, I'll also tell you this can take time. So, progesterone, if you're not sleeping and you take progesterone and it works overnight, you know it's working. If you take progesterone and it doesn't work, it's not going to work. Progesterone is not one of those that has to build up in your system. You
Okay.
have to
That's good
like,
to know. Yeah.
you can adjust the dose, right? So we typically start around 100 milligrams. If you wake up feeling groggy, then the dose is too high. Or if it's working but not enough, then you can increase it. But that's one that can be pretty quickly changed. Where
Hmm.
estrogen and testosterone, it's going to take months, like 6 to 9 months to actually like hone in on what dose is best for you, how is it working, because it takes time. And so you have to be patient and you also have to be very cognizant of your symptoms that we're trying to fix. Right. If
Yeah.
your issue is irritability and brain fog, then I need you to tune in every day
Right.
and really be like, how am I feeling? Because I am not going to base your dosing and changing of that off of your numbers. I'm going to base it off of how are you feeling?
Yeah.
Right. And
And
so
that's
That's a long-winded answer for
No, that was a
what you're
phenomenal
doing.
answer because that gave me a lot of information as far as really focusing on how you were feeling. And that's one of the things that I always tell people, you've got to track what's going on. And that's why I wrote the tracker to help women do that. But it that is the thing. We've got to know what's going on and we got to see are we actually are is the treatment actually working? Am I if I'm struggling with brain fog and I'm doing this treatment, do I have less brain fog? I did testosterone. I was on testosterone for about a year and a half. And what a huge difference. Like I
Mhm.
cannot explain, like it was from, it was 180 degrees of how I felt. And so I knew that it was working. And so, like you said, you've got to pay attention. You've got to hone into those things. All right. So, last question before we wrap it up is how can women advocate for themselves when they feel dismissed from doctors? Like, what is your 2 cents if they can't come to you and get some relief?
Mhm.
What are some ways that they can work?
Sure. So if your current provider dismisses you, it's not worth the fight because they're dismissing you because they don't understand the
Yeah.
information, because they are not equipped with that. So don't fight with them. You're trying to get information from somebody who isn't going to be able to help you anyway. So if they're a great primary care provider for everything else, cool, keep them for that. But you have to find somebody who can deal with hormones. And so direct primary care offices are all across the country, and a
Okay.
lot of them are like us, where it's like we do what our patients need, right? We have the time to do that as direct primary care providers. So if you are not in Texas, you can search Direct Primary Care Mapper or DPC Mapper. It'll pull up a map of all of the offices like ours across the country. Of course, ours is the best, but there's other people out there who are good at this.
Yeah.
And most of these offices will offer you a free meet and greet. That means you can go in and meet with the provider for 15, 30 minutes and make sure that it's a good fit. Ask those questions like, hey, what do you think about hormone treatment? If they're
Yeah.
like, oh, it's bogus, you're in the wrong place.
Yeah.
If there's nothing on their website that says the word hormone treatment, they're probably not your people. And so finding that person, I'm going to tell you, they may not be on your insurance plan.
Mhm.
Most providers that are in that insurance world, they struggle because they don't have enough time because they have to see 30 patients a day. They don't have time to deal with it. So you may have to find somebody outside of your insurance realm and understand that you're going to have to pay cash for that. It's what we do with everything else in our lives, right?
Mhm.
From our cars to
An
our house cleaner,
investment.
like you pay for what you get. And I
Yeah.
understand health insurance is there, but your health insurance is there really there for those catastrophic things, right? You fall off the roof and break your leg, you get cancer. That's what health insurance is meant for. Your day-to-day things, that's not what health insurance is meant for. And so you may have to pay out of pocket for it. And that's what you have to be willing to do. So being an advocate for your patient or for yourself and finding the person who's going to listen to you is on you.
Yeah.
And I'm going to tell you, it's likely not in your HMO plan or your PPO plan. Like they just they're unicorns in that world, but there are people out there who can do it. I'm going to tell you, ask your fellow mom friends because
Hmm.
they probably are dealing with the same thing. And thankfully, women are starting to actually talk about it.
Yeah.
I feel like for years it was just like this silence, like, ooh, we don't talk about drive vaginas. It's like,
Yeah.
oh no, if you have sandpaper between your legs, we
Oh
can
my
fix you.
God. It's the worst. I'm telling you, I tell everybody when I was struggling
Yeah.
with that, I'm like, what's going on down here? Anybody else? Anybody else?
Uh-huh.
I need to know. But yes, I've
Yeah.
seen women posting on like the Facebook, local community areas. Hey, does anybody have a good doctor that does hormones and all? And I'm like, yes, sister, talk about it and
Yeah.
put it out there and share that information when you do find it.
Yeah.
And I do love like one of the things you told me when you were first, kind of just giving me an overview of how your office runs and showing me around is like you said, with something like in a situation where you're at, you can see that person when they call, whether maybe it's the same day or a day or two, instead of I'm struggling. I
Yeah.
can't have, sex with my husband because everything hurts. I've got terrible brain fog. So now I'm a shit show at work. I'm yelling at my kids, or whatever it is. And then they're like, okay, we'll see you in 4 to 6 months. And you're like, I'm going to kill somebody between then. So I
Yeah.
love that when we're looking for this, this outside of the norm medical care that you actually can get
Yeah.
treated quickly,
Yeah. I'm
not
gonna
play
tell you,
around.
if you're healthcare provider's office will not return your phone call in the same day, you need to find somebody else.
Yeah.
And if you can't talk to the actual decision maker, right? Like that's a problem. So like
That's a
our
good
office,
one
we don't
too.
have receptionists, we don't have medical assistants, we don't have nurses, we just have nurse practitioners. So if you send a text message to our office, it's going to your provider, the person that has to actually make the decision. And so, yeah, if you have to wait weeks to get a response from somebody, or you cannot actually get the provider on the phone without paying them a fee, you should probably find somewhere else.
Yeah. Yeah.
So,
And I love
I
that. And
get
I
it. Like,
think it's just empowering people to know that you don't have to just, bite the bullet. You don't have to take this.
yeah,
So, oh my
yeah.
God, this was so much great information. I learned a ton of
Ah,
good stuff. So I know that other people are going to learn a ton of good stuff from this too. So I appreciate your time and your expertise on this. And I'm excited to hear about what they learned at the conference so that you can
yeah.
fix what's going on with
I know.
me and my
I told them
issue.
all, I was like, who's gonna fix me?
I know.
Who's
I'm
fixing
like,
me right
somebody
now?
help me, please. We think we have all the answers until it's our turn, and then we're like, wait a minute.
Wait, what do
It
I
is
do
unique.
about
It's
this?
unique and different for everybody. So it's just trying to figure out what works for you and listening to your body. So I love all of that.
Absolutely, for
All
sure.
right. Well, thank you. And I will share all of your information as to where they can
Yeah,
find you, what your website is, so they can check that out. And any questions that they have. And so they can locate you or ask you questions about, how to find
absolutely.
somebody near them. All right. Well, thank you
We
for
are
your time,
here to
Monica.
help.
I appreciate it.
Of course, Karen. Thanks for having me.
Mhm.